Hello everyone, and welcome to our virtual educational program. In this module, we will be discussing home healthcare services. As a caregiver, your role is essential in providing care and support to your loved one. However, it's crucial to recognize that you don't have to do it all on your own. That's where home healthcare services come in. What are home healthcare services? They include a wide range of healthcare services that can be given in your home for an illness or an injury. Home healthcare is usually less expensive, more convenient, and just as effective as the care that your loved one would receive in a hospital or in a skilled nursing facility. Home healthcare can include a broad range of care such as nursing, physical therapy, occupational therapy, speech therapy, and medical social services. Additionally, home healthcare may also include assistance with daily living activities and education on medication management. As such, the goal of home healthcare is to treat an illness or injury in the home environment, such that your loved one can regain independence, become as self-sufficient as possible, and maintain their current level of function or slowing the decline of a progressive condition. Home healthcare services are typically covered by Medicare. However, it is important to remember that Medicare only pays for home healthcare services for individuals who are eligible and for services that are provided by an agency that meets Medicare standards. First, who is eligible to get Medicare-covered home health care? If you have Medicare, you can get home health care benefits if you meet all of the following conditions. First, you must be under the care of a doctor or allowed practitioner, and you must be getting services under a plan of care created and reviewed regularly by a doctor or allowed practitioner. Second, you must need, and a doctor or allowed practitioner must certify that you need, one or more of these: intermittent skilled nursing care, physical therapy, speech-language pathology services, or continued occupational therapy. To qualify for such services, either your loved one's condition must be expected to improve in a reasonable or generally predictable period of time, or your loved one needs a skilled therapist to safely and effectively make a maintenance program for their condition. And lastly, your loved one must be homebound, and this needs to be certified by a doctor or allowed medical practitioner. To be homebound means that either your loved one has trouble leaving your home without help, such as using a cane, wheelchair, walker, or crutches, special transportation, or help from another person, because of an illness or injury, or your loved one is normally unable to leave the home. But if they do, it requires a lot of effort. Additionally, keep in mind that one is not eligible for home healthcare services if they require more than part-time or intermittent skilled nursing care, which is fewer than 7 days each week or less than 8 hours each day over a period of 21 days. In other words, if you require assistance for more than 8 hours a day for 21 consecutive days, or more than 7 days each week, then you are not eligible for home health care. Second, choosing a Medicare-certified home health agency. Finding the right home health agency that is certified by Medicare and that suits your needs may be challenging. The first step is to find a Medicare-approved home health agency. You may do so by asking your doctor or social worker, or by searching on the Medicare website. Please scan the QR code on this page for the Medicare website, or view our additional resources. Once you find a few agencies that may fit your needs, you may go through this home health agency checklist to help you compare and choose the best one for you. A printable PDF of this checklist is available in our additional resources. After confirming your eligibility and finding the home health agency for you, your family, the agency, and your doctor or allowed practitioner will work together to develop your loved one's plan of care. This plan includes any services you should get for your health condition, including services provided over the phone or through telehealth. Remember, your loved one has the right to be involved in any decision about their plan of care, which should include what services they need and how they will be provided, which healthcare professional should provide these services, how often such services should be provided, the visit schedule, the medical equipment your loved one needs, and what results your doctor expects from the treatment. The plan of care should be reviewed by your doctor and home health team as often as necessary, but at least once every 60 days. It is important to remember that a person with Medicare getting home health care from a Medicare-certified home health agency has several rights, including the right to get a written notice of their rights before the care starts, have your home and property treated with respect, be told in advance what care your loved one will be getting, and when the plan of care is going to change, participate in care planning and treatment. Get written information about privacy rights and appeal rights, have personal information kept private, get written and verbal information about how much Medicare is expected to pay and how much your family will have to pay for services, and make complaints about the care your loved one receives and have the home health agency follow up on them. And lastly, to monitor the quality of home health care your loved one is receiving, please use this resource. A printable copy of this checklist is available on our website. For a more detailed explanation of home healthcare services, please visit our website for the Medicare and Home Healthcare Booklet by the Department of Health and Human Services. Thank you for your attention during this presentation. We hope the information provided was helpful to you.